We have a couple second-year students. We have, Richard Bruno on my far right, second-year student for doctor, and then Alan Andrews. Alan Andrews, right. Yeah. And he's also, you're both second-year students?
Yeah, we're both, I'm a second-year medical student, so is Richard. We're studying at OHSU right now.
Okay, what does second year mean? I mean, you're in the second year of your PhD?
No, so second year of a medical degree, so it's an MD degree. So usually you have to go 4 years to undergrad to get a bachelor's, and then after that you have to apply to medical school, and then it's another 4 years of medical school, and then after that it's another, depending on what kind of specialty you want to do, if it's family medicine versus ENT surgery or trauma surgery, it's 3 to 7 years extra training.
So you're just getting started then.
Yes, with a mountain of debt.
The mountain of debt. Yeah, yes. that is a whole show in itself. Yeah. Whether it's law or any of the professions, and even outside the profession these days, what folks have to go through in order to get out of just a regular college curriculum with $100,000 in debt.
Mm-hmm. I think the average for medical school. Do you know?
I think it's like 200,000 right now.
Which works against people getting out there and being able to do what they want to do necessarily.
That's a really key point. I think it's actually more than 200. I think it's like 250 when you get out of college, or 200 when you get out of college. But it's the accruing of compound interest over time. That at the end of when you pay it off, it's probably $400,000, and it does limit one's ability to kind of choose their profession based on what they actually want to do with their trade, because certain trades provide more money for their time and effort, and so sometimes that is a limiting factor, unfortunately.
That brings up an issue to me. I mean, tangentially, that my biggest problem with what things are going on now is with the healthcare system is if nobody addresses the costs of it, and whether it's the cost of us going in there to the emergency ward and having your eye patched up and cost you $1,000, or the cost of students trying to get through school, that whole thing is so much slanted against people from the community being able to better themselves. And you both are strong enough or willing enough or whatever it takes to go off into that. And at the same time, you're believing that the direction, taking the conventional way of looking at things, not talking about the cost of it, you're still believing that the single payer is a better way to go.
Absolutely. Yeah.
I'm thinking, why you would think that.
Well, actually, we had an assignment in class just recently, and we had to compare the U.S. healthcare system to another country. And, every student got a different country, and we got to look at them. And I've already done.
To do it.
Yeah, it is. I mean, it really kind of puts things in perspective. It lets you look at, the cost of things like, a simple procedure, just going into the ER, like you said. It lets you look at things like outcomes, where do we stand with infant mortality? How often are our babies dying? And how can we save, those babies or those mothers who are giving birth? It challenged us to really look at those things, and what we were finding many times is that actually, the countries that had a public system in place, a nationalized healthcare system, be it a single-payer system for the most part, had much better outcomes. They were able to achieve those goals for cheaper, and it really sort of opened a lot of eyes. Obviously, Alan and I have done a lot of this sort of, we've done a lot of research ourselves, and we've looked over a lot of the papers that have been coming out recently that are showing within our own country that there's 44,000 uninsured Americans dying every year, and there's 50 million uninsured in total in our country right now, and with the latest healthcare law, the PPAC is aiming to improve those numbers. It's trying to reach out and get more people into the system and get them covered. But the latest estimates are that there's still going to be 23 million uninsured in the next 10 years.
That's the PPAC? What's that?
Yeah, PPAC is the Patient Protection and Affordable Care Act. That was signed last March.
So what you're saying then is the Obamacare, to use the right-wing term for it, is not going to really bring on and give health care to a great number of the folks that need it?
It certainly makes strides, but it's not going to be enough, and that's what we're seeing.
So to compare one country specifically, because we're mainly here kind of pushing the single payer conference that's happening tomorrow. Right. So we have a list of a lot of national speakers coming from DC, like Representative Conyers and one of the PNHP leaders, Margaret Flowers. And so we have a unique opportunity, irrespective of the federal bill, the federal bill is speaking specifically to the PPACA bill, but there are provisions now, I believe, within the federal mandate that allows states to kind of create their own healthcare system. So we think, as students, we think that the next kind of battleground, if I want to use a kind of a war term, is kind of trying to change the healthcare system within the state.
Right. That's how Canada did it. They started province by province. They showed that within their own province they were able to do a single payer system, make it effective, cover everyone universally within their province at a cheaper and more effective way. And then it just caught on and it spread across the whole country. And that's sort of the strategy now, is we're looking at state by state, what can we do. Vermont is a very exciting place right now to be. I don't know if you've heard of their recently elected governor, Shumlin, he ran on a single payer platform. And so they're looking to use Vermont as sort of this experimental lab where they can implement their own single payer system within their state and show that it's going to be an effective and equitable way of providing health care to everyone. And then other states are going to take notice. They're going to say, look, they're getting out of their budget deficit, they're able to cover more people, and maybe we can try something like that in our state.
And there's a lot of different ways of going about it. It doesn't have to be this or exactly that. Didn't Mitt Romney come up with something that was a little bit progressive in Massachusetts or something?
Well, so the Massachusetts thing was a mandate, not too unlike the PPACA. So what they said is everyone has to have health insurance, and we'll help the people who can't afford it. We'll subsidize partly. But it just turned out to be a little bit too expensive, so people weren't opting in like they could. And so they didn't get quite the numbers they were hoping. So it didn't. It wasn't quite a single payer system, but it was more like the mandate that the federal government now is trying to have.
And I think that really gives a lot of fodder to the right wing, that it's big government forcing you to do it. I mean, I don't know if that was such a good idea.
That's actually a great point. The notion of big government and why that's used as a fear tactic. In reality, if we want to actually, the way I think of healthcare in America today is there's three main processes for me. The first is it's a human right, I believe. I don't remember Hippocrates back in the day saying, how much money am I going to get from this individual to provide health? Right? It's part of our ethic as physicians in the future.
Yes,
healthcare
first
providers.
do no harm, not first get paid.
For sure, exactly. And second is economically, because I feel like a lot of the individuals on the right or the left use providing a kind of a single payer healthcare system as something that is more costly than is not. In reality, there's this country in Taiwan, Southeast Asia, that created a single payer system in the mid-90s, overnight basically. They had, I don't remember exactly the numbers, but their budget for healthcare was close to ours, which is about 15 or 16% of GDP. And they went from that almost overnight in the past several years to 2% of administrative costs. So you actually save money in the long term by providing preventative and primary health care. That way you don't have people going to the emergency room as their primary care physician, right?
Sure.
So in the long term, it actually provides a security net. And in America, we have to think about healthcare as a national security. We have 33% or more of individuals who are either obese or overweight. That is a problem. How are we going to compete on an international stage with countries like China and India if we are an apathetic, overweight population? We have to kind of stimulate our economy by supporting our health. And since I believe it as a national security, or on a state level, we should kind of impose that or try and kind of create an equitable single payer system here in Oregon. And that's kind of like our goals and our passions at this point.
I was just reading a really brief article in the first magazine of the year with all the stories of 2010 in Discover, and America's obesity was one of the first ones I was reading. I mean, it's Jay Leno talks about it, makes a joke at least every week about it. How fat are we? He's always saying. And that, I would think, I don't know if you have any statistics of how much that affects the health of this nation. When you add, the cigarette smoking and the fatty foods and all that, the country you mentioned, it dropped it down to 2%. They probably eat a lot more rice and they eat better, right? Was it Indonesian country?
It was Taiwan. So Taiwan, which is a semi-autonomous country with China feeling as though they have dominion over them, but they have an autonomous government and they implemented this. With actually the health minister was a student at at one of our universities here who was trained in public health and then went back to his country and became the Minister of Health and implemented the single payer program in their country.
Well, since Obamacare, as it's called, to me, it seems like it was as much or more of a giveaway to the established pharmaceutical companies and all that, and they're trying to revoke it, but apparently that's not going to happen. People hear about that on the news all the time, but you don't hear anything about organizations like yourselves and probably other people all over the country that are trying to move forward and make it better.
Right, and we're utilizing a section in the PPACA bill that was written by Senator Wyden here in Oregon, which essentially allows for a state to do its own innovative solution with regards to getting the same funding, federally funding, to do their own thing within their state, starting in 2017. So essentially, the bill, the law says you have to get an exchange in place by 2014, and then by 2017. So it doesn't really make sense. So there's efforts now to try and push that 2017 up to 2014 so that we wouldn't have to implement an exchange within Oregon. And now, if you're familiar with the exchange, that's sort of the price line of health insurance companies. It's a website you'd go to and you'd say what kind of plan you want, and it would show you all the different private health insurance companies that would be able to compete for your business in that respect. So instead of having to set up an exchange and basically give a handout to all the private health insurance companies in the state, what we would try to do with using Senator Wyden's section would be to implement a single payer system by 2014.
In the state.
In our state, something that's going to cover every single Oregonian, something that's already sort of in place with something like the Oregon Health Plan. So it would be simply something like expanding the Oregon Health Plan, creating a dedicated tax by which everyone would pay in, very similar to like what Medicare is, and then essentially everyone being able to access medical care, dental care, vision, pharmaceuticals, the things that they need in order to be healthy. And so that's sort of the goal going forward from this conference tomorrow, is gearing up for legislation during this legislative session. There's a bill that will be introduced by Michael Denbrow, and it's going to essentially do just that, create a single payer system within our state that allows everyone to buy in.
It seems to me that I remember that George Bush, when he was campaigning for president in 2000, really stressed the importance of states' rights. But it just seems to me at the same time the conservative side of the aisle is working against this, what do you call it, PPACA? The PPACA. They're working against this and wanting to repeal it, but at the same time, isn't that one of the strongest provisions of it, is allowing the states to do it?
Right. So in my opinion, there's common cause here. It's not a partisan thing. It's looking at our, if the politicians can look at their constituencies and say, I have the ability to help the people that I serve access better health care at an affordable price, it makes sense that they'd want to vote for something like that would allow states to do their own things and also be for the good of the people.
I think there's the fear that with a single payer or even a public option, that the option for capitalism to exist would no longer be viable. In reality, a single payer is not taking away the opportunity of capitalist private healthcare insurance companies to exist, but rather what they do is actually create the marketplace more competitive.
Which is what capitalism is.
That's the irony of not wanting to have a public option or a single payer system, is that in reality you're not actually supporting a capitalist system because you're not allowing for competition to exist. The reason why we have such high prices in healthcare now from private healthcare insurance companies is because they act as a single unit where they actually control the market. So if you want to actually have a levy of that on the other side, an opposing force, then you have to have the government, you have to allow for the government to kind of create another option, right? It's not right to penalize individuals to not get healthcare insurance by giving them either a tax or a penalty fee. That's kind of somewhat illogical, right? In reality,
it estranges people.
Yeah, exactly. In reality, the outcome, as Rich was talking about, is to provide access and quality health care to all of our citizens as a public trust that the government and our society provides to the people.
Mm-hmm.
So the only way that we can actually do that is to kind of create a balancing force that in reality supports the capitalist system that we all believe in.
Now, is all this just too complicated for our elected officials to understand? What is going on here?
I think I love Rich because I always think of Rich when I think of this Latin term, because Rich loves Latin. It's called qui bono. Qui bono means who benefits. So it's not that the Republicans or federal elected officials are necessarily say dull-witted, but rather their interests are in a different field.
They're looking somewhere else.
Yeah, yeah, and I think this takes me back to someone that we've had here in the Portland community a couple months ago, which was Lawrence Lessig, who wants to kind of create a public campaign through kind of public funding, not private funding, because then the individuals who benefit from getting money from the government, from private individuals or lobbyists, are not going to be in favor for the people. Right? They're going to be in favor for the people who give them the money that allow them to kind of have the ads on TV, right? So we've become, in essence, an oligarchy per se, or a plutocracy, you could say, versus a democracy. Yeah, of course. Yeah, to give the people the power.
Because we're going in that direction on a lot of different levels already. Yeah. You know, what you're talking about kind of rings a little bit true with me, because I've been really understanding why, like the Tea Party and a lot of these folks are just banging their drums about Obama and Obama being a socialist, when it's so darn obvious to me he's a corporatist and he's a capitalist. And from what you're saying, it kind of makes sense that I can see how people could construe it that way or misconstrue it that way.
Yeah.
But he's setting this, he set this up. Well, actually, he didn't really set it up so much as the Congress set it up, right?
Oh yeah. I mean, you look at during the height of the national health care debate, over the year or so that they were fleshing out the bill and they were having hearings, the health insurance companies were spending $1 million a day on lobbying. They were working as hard as they could because they knew if they worded it right, it was going to mean big business for them. And that's exactly what happened. There was no public option, which would be really difficult. That would be a huge blow to their business model. If there were some sort of government option for them, for people to buy into, that would take a big chunk out of there. Sure, they have to give up, pre-existing conditions, and keeping kids on their parents' insurance plans till 26, things like that. They were willing to make small sacrifices like that, but when the exchanges happen in 2014, they're going to see a huge surge.
Just to follow up, the notion of I've talked about this with my classmates and friends. The notion of health insurance, right? It's kind of almost a misnomer. It shouldn't be health insurance. It should be a national health program, right? That provides health care to its citizenry. And insurance is something like a car or house that you don't want broken down, right? Whereas our bodies will eventually break down.
There's going to be
a program, a program needs to be instituted that allows people to get care for their needs, right? And insurance is something that we're always going to be at our peak shape and we're never going to get hurt.
Well, terminology always controls the debate.
Yeah.
It seems like.
Yeah.
So, but we want to mention this. We got 4 minutes left. I had some other direction to take it, but I forgot that at the moment. But we should talk a little bit about this healthcare conference that's happening tomorrow.
Yes.
And where's this going to be
Tomorrow it's going to be at the First Unitarian Church, Southwest 12th and Main, downtown Portland. We're going to have a full day of lots of great speakers and breakout sessions. We have over 50 organizations from around Oregon that have endorsed this conference, representing a total of over 100,000 Oregonians in their membership. And we have people coming from labor, healthcare, faith-based communities, people coming together realizing that in order to really help our population in our great state, the way forward is going to be a single-payer system, and just figuring out how we can become better advocates for that. So there'll be something for everybody. If people want to come, you're just hearing about single-payer for the first time right now. If you are a seasoned single-payer advocate and you've checked out all the other systems around the world, and that's what you have come to conclude based on the obvious evidence that's out there. There's something for everybody. We're going to have a single-payer 101 session, which will be for those people who want to get sort of the basics, and that's going to be given by Dr. Margaret Flowers, who's the Congressional Fellow for Physicians for a National Health Program. She's coming out from D.C., and she's a wonderful speaker. She's very inspirational, and she believes in health justice and health equity, and she champions those things. She was one of the few that was arrested during the original debates that happened around Senator Max Baucus's original sort of healthcare committees when they were trying to get the input on how the original health law should take shape. She was one of the ones that stood up and said, well, we think you should think about a single payer system. And she was escorted out along with 7 other people and arrested because she wouldn't back down. So she's a very passionate and staunch advocate for this.
Well, there's a lot of room for folks to show up and learn a little bit about this. I imagine that there's a price to get in, but
sure. Well,
if you can't afford anything, no one's going to be turned away.
No one's going to be turned away. It's $20, but if you can't pay it, that's fine. Just try and come out. We have over 250 people registered right now, and we'll probably have another 50 to 100 coming out tomorrow. So there's room for a lot of people to come and learn sort of how to be a better advocate for these kinds of things, because even if you've decided that single payer is a good way to go forward, maybe you're not really comfortable talking to your neighbor or your family member about it. Maybe coming to a conference like this would give you the knowledge in your armamentarium that would allow you to have these kinds of discussions, talking to people, because I think just talking, people start to understand that really, if we're talking about having an equitable system for everyone and not having people die in the streets because of lack of being able to go see the doctor, then this is really a conference.
And we have to remember, like that Paul Hochfeld and Mike Huntington did that Matters Health Doctors tour back there, and they couldn't get in to see the president, but he had already met with the pharmaceutical companies, and before any of these debates got going, already backed up and made them promises.
Right.
So it's up to the community to conduct itself like a community and meet in these places like the two folks are trying to organize and learn what you need to learn and learn. I'm running out of time here.
No,
learn that you're not alone.
No, and that's the point. I know we have
we got about 20 seconds
left,
here.
but I mean that's one of the, I'm not from here originally, but I chose to come out here to medical school because there's so much opportunity here in Oregon for us. I mean, it's a fairly, I wouldn't say progressive, but it just has an opportunity. It's a very creative environment, and what we're trying to do is create a policy that provides health care for all of us here.
All of us, all right.
As a model for the rest of the country.
All right, and Oregon's good at doing that, and I really appreciate you folks showing up. It's like 5-6 seconds left, so thank you for tuning in. We'll be back next week, and see you tomorrow.